mentioned that you wanted to lead a community-by-community assessment of what it would take to support kids under 5.
Yeah.
What does that actually look like, sort of in the real world?
It's really exciting. Let me see, my longer-term goal, and we put it on the web last week, I want to end child poverty in the state. I think we can do it. I think we can do it in a decade. But part of it is beginning to work with kids under 5 as a starting place. I think they should succeed. Now, the model I have, frankly, comes from 2 other countries. I've worked all over the world. One is New Zealand, where I keynoted the New Zealand agenda to end child poverty. It began 4 years ago, and they're going to do it. And I also helped organize a program called the Early Years Collaborative in Scotland. These are community-by-community efforts which have at least the following properties. The first is from the government level, from the governor's office or the prime minister's office. Every single agency is given an instruction which is to work together surrounding the kid or the family or the poor or the problem of poverty. When you do that, when you begin to have cooperation, costs fall and effectiveness goes up. So the instruction goes out to mental health care and social services and health care and corrections and education and housing. You are one team, and in the center is a child. Work together for that child. That's been my approach as an executive for decades now, working on improvement. You're always better together than separately. You set bold goals, and the goals have to be 0. I think 0 homelessness, 0 hunger. Let's go there. Let's do it. Let's decide to. And then as a governor, it's going to take day-to-day management. And I've said, if you read that website, I will lead it. And I mean I will lead it. I mean I will be out there with communities all over this Commonwealth to make it happen. And the last piece is to distribute the action. Pittsfield is far smarter than anybody on Beacon Hill is about how to help Pittsfield get out of its problems. New Bedford knows what to do if New Bedford's given the support to do it. The same for Fall River, the same for Greenfield or Athol or Orange or Dorchester. So the idea is to release the energies and the knowledge that exist in the local communities, and then what happens is magic. Someone in New Bedford thinks of a great way to improve infant bonding, and someone in Greenfield figures out a great way to help a 4-year-old learn to read or get ready for school, and then they share it. So the whole state becomes a learning state, just like they talk about learning organizations. I'd love to lead that. That's what I tried to do at CMS, at Medicare and Medicaid, and that's what I did for all the time I ran the organization that I founded, Grew.